I'm trained as a medical anthropologist, and here we go. Some of the slides are out of place. Medical anthropologist. Medical anthropologist is a person who investigates disease, illness, medical problems, theories of illness, and healthcare systems in different cultural and ethnic groups from a bio, psychosocial, cultural perspective. In other words, we take a holistic perspective. That's the bottom line when we try to develop initiatives. We try to take all the factors into account. The specific goals. Now, one of the reasons I got into this particular issue of food choice and obesity was a diabetes project that I was involved with at Indiana University in Indianapolis. And one of the major issues that they had involved was trying to evaluate why African Americans did not adhere to their diabetic regimen. And these are some specific goals of the diabetes study. And here's the research design. What I want to get to is I had a number of African Americans and European Americans in the study. And we were actually in the clinic. And one of the aspects as a medical anthropologist, I'm just showing you some social demographics, but the key findings, here we go, the key findings were, one, African Americans 50% were less likely than European Americans to recognize diabetes-related symptoms. Two, African Americans 50% were more likely than European Americans to join a support group for their diabetes. And one of the other key issues that really highlighted the issue of weight and food choice was European Americans 100% were more likely than African Americans 80% to believe that excess weight is related to diabetes. So there was a disconnect between the African American population, patient population, between weight and diabetes, this chronic disease. There was a disassociation. And I was trying to figure out, why is there a disassociation between weight and diabetes? And that's when I was working with the clinical team, they were curious of why was there this disconnect. So I would sit down with my informants, and here are certain types of comments from my informants. Quote, one of them said, "I'm not sure what caused my diabetes. I know that there is a family connection to diabetes, and my weight has something to do with it, but I don't take all of it too seriously." That's what they actually said. Don't take it seriously after being encouraged to start their diabetic regimen. Another quote from one of my informants: "My sons and husband want their meals the way they normally have it. They don't want no unseasoned meals, so what am I supposed to do?" Here is a caregiver trying to make changes in the dietary regimen, but she's highly influenced by her family members. So she's trying to negotiate a diabetes dietary regimen, but she's still trying to adhere to her family. Now, another reason why I wrote this book was my personal weight gain. Well, quite frankly, these are many times issues why a lot of researchers get into their own particular research. It happens to them. And it happened to me when I got a job from moving from Little Rock, Arkansas, from University of Arkansas Medical Science Center, where I was working in the cancer center, and then got my so-called federal job with the NIH, moving to Bethesda. And there was this issue that, you know, when you get a new job, you want to get new clothes. Well, I wanted to try to get some new clothes for my new job, and I went to get some new suits, and I couldn't fit my suits. And my wife and kids laughed. They said, "What's wrong, Dad?" And they said, I was trying to figure out what happened. They said, "You're fat. And they said it to me. And it was hard for them to come to that, because here I am, very busy with my career. But then I tried to, change my suit, and they just came right out of it. And that was a good thing at the time, because I was in denial. And a lot of individuals in my community are in denial. So there was a cultural health issue associated with the weight gain, not recognized or not discussed enough. Simply not discussed enough. So here's some quick data on overweight and obesity in the African American community. 61% of U.S. adults are either overweight or obese. Obesity increases in men and women and across all social demographic groups. There are more overweight, obese people in the United States than people of normal weight. This is from the CDC. African American adults, 30.5 20.4% were considerably more likely than European American adults, 20.8%, to be obese. African American women, 34.9%, were more likely than African American men, 24.9%, to be obese. Now, these are the numbers that the federal government uses. African American obesity rates increased from 19% to 1991 to 27% in 1998. Hispanic Latinos obesity rates increased from 12% in 1991 to 21% in 1998. So what are certain social cultural issues? I tend to focus on the social cultural issues, looking at this data, but what are certain issues that are not being discussed from the researchers, and also in the community, and also individual families? So I kind of slowed my research down, looked around and said, here are certain issues that tend not to be discussed. Body image preferences in the African American community, food preferences, exercise and physical fitness preferences, and adding African American culture to health, fitness, diet, and food programs. Body image, very quickly. What is the generic definition of body image? It is the internal and subjective representation of physical appearance and bodily experience. Body type is the ideal which one measures or compares one's own body size and shape. We need to understand how this is interpreted in every community, particularly in the African American community. Some critical thinking questions to ask. Do African Americans prefer a particular body type? What are the preferences of body images among African Americans? How do African Americans perceive a healthy body type? And how do African Americans perceive an overweight or obese body type? We need to ask those questions. And here are some of the qualitative questions that I gathered from research, from a lot of other researchers. For example, quote, I don't hear that a lot. I hang out with black people and they don't care. We don't worry if we're fat because we all be drawn away from that. These are from adolescents, middle and high school. That was just one quote. I have several quotes in the book about the issue of body image and body type. Food preferences. A basic definition of food: any substance that provides the nutrients necessary to maintain life and growth when ingested. Food habits. Have to find people's pattern. What are their food habits? Ways in which humans use food, how food is obtained, stored, and how it is prepared, how it is served, to whom, and how it is consumed. Critical thinking questions. Is there a distinguishable set of foods that African Americans prefer? How did this set of food preferences become established in the African American community? How is soul food viewed in the African American community? And why do a large percent of African Americans adhere to a traditional soul food pattern? Some qualitative comments from various focus groups. Quote, soul food consists of the way you cook it. You take like your green vegetables. We as blacks cook our green vegetables different than whites. We ate basic things like chicken, fatback beans, chitlins, a lot of pork, homemade stuff like bread, hams, grits, fruit, vegetables, and stuff like that. Here is a quote from Patti LaBelle's. I started doing the research across the media. What's out there in the media? This is a quote from Patti LaBelle's book saying that, well, I realized why cooking has always been such a labor of love for me, because it's much about friendship. So it's more than, it's a lot of different things. And then there's exercise and physical fitness. Have to understand, what does exercise and physical fitness mean to the average African American? And here's some critical thinking questions to ask of physical exercise and physical fitness. Quickly, for example, one comment: I don't exercise that often, but when I do, I have time to walk around the building with my children and go to the park and play with them. I want something that I can do every day, but not too long. Another quote: I want to do the type of exercise that helps me get toned and make me lose some inches. Here's another quote. I'm going to keep on moving because I'm almost running out of time. Here's another quote: but if exercise is by yourself, I'm not motivated. Without the structure, I won't do it. Exercise is like the way down on the bottom of the list. I had my first heart attack. I'm supposed to ride a bike, but to be truthful, I do it very seldom. So if it's not a priority, it's way down on the list. And there's several different best practices across the country in various research studies, federal public health programs, certain successful books. And as an individual, I felt committed to develop something. That was the New Black Cultural Diet that we developed, me and myself, and then my wife was a part of it because we developed certain dialogue. That was one of the keys to this New Black Cultural Diet website, is that we started talking about body image, food preferences, food selection, and exercise and physical fitness. It starts off with dialogue most of the time in every community, particularly in the African American community. And one of my take-home messages is, of course, culture. It's a system of shared beliefs, values, customs, traditions, and behaviors that are transmitted from generation to generation through learning. Culture is extremely important to engage with, to learn, and then cultural competence, where we develop some behaviors, attitudes, and policies that can come together around this cultural issue concerning food and concerning overweight and what is healthy and fit to the average African American. And my final message is, I always give this passage, it's called Follow Your Dream, and it goes something like this. Follow your dream. Take one step at a time and don't settle for less. Just continue to climb. Follow your dream. If you stumble, don't lose sight of your goal. Press on to the top. For only on the top can we see the whole view. Can we see what we've done and what we can do? Can we then have the vision to seek something new? Press on and follow your dream. Thank you for your time and participation.